we're going to finish up by looking at the classification of nerves. So when it comes to the classification of nerves, they can be mixed, sensory, or motor. Most nerves are mixed through a mixture of afferent, efferent fibers, and even somatic and autonomic visceral fibers. So the coding that we would see is mixed nerves, carrying both sensory and motor fibers, and that's impulses to and from the central nervous system. If it's just a sensory nerve, it's carrying afferent signals or impulses only towards the central nervous system. If it's a motor nerve, it's carrying efferent information or motor output, and that's going to be going from the central nervous system. So next we can look at the 12 cranial nerves, and in your textbook it goes over kind of ways to remember the 12 cranial nerves by order and also by function. So by order, by name is on occasion our trusty truck acts funny. Very good vehicle anyhow. I would recommend you come up with your own, but that one's as good as any. And then by function, the phrase is, some say merry money, but my brother says bad business, merry money. Again, not my favorite, but where there's an S, that means that that neuron in that order is sensory. Where there's an M, it's motor. Where there's a B, it's both. So here we can look at the different cranial nerves. So at the olfactory bulb, we have the olfactory nerve. Here, just above the optic chiasma, we have number 2, the optic nerve. Oculomotor is 3, trochlear is 4, trigeminal is 5, abducens is 6, facial nerve is 7, vestibulocochlear, which is the combination of the vestibular and cochlear nerve, is going to be cranial nerve 8, glossopharyngeal nerve, that is cranial nerve 9, the vagus nerve is cranial nerve 10, the accessory nerve is cranial nerve 11, and number 12 is the hypoglossal nerve. I recommend looking at these cranial nerves, knowing their name and their Roman numeral. You should know that olfactory and optic are sensory only. Olfactory is a cranial nerve sensory for smell. Optic is a cranial nerve that's sensory for vision. Oculomotor was that cranial nerve that innervates 4 of the 6 extrinsic eye muscles, and trochlear and abducens did the other 2. Others that we can look at are things like vagus, which is going to be sensory and motor. It's sensory for taste and also does some motor function when it comes to certain muscles, especially those around the head and the heart. So those are just some examples of what these cranial nerves can do. But let's finish up with the spinal nerves. Again, make sure to go back and look at the cranial nerves in your textbook and look at what they do, have an idea of their general function, and that should have been covered in your lab. But for spinal nerves, we have 31 pairs of mixed nerves, and for the most part, the number of spinal nerve matches the number of vertebrae in that same area. But you do have one extra spinal nerve for cervical. So you have 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal spinal nerve. Now, the reason there are only 7 cervical vertebrae, yet 8 pairs of cervical spinal nerves, is number 7 exits the vertebral canal, both superior, and also there's one that exits inferior to vertebrae 7 when it comes to the cervical region. For the most part, other spinal nerves just exit inferior to the vertebrae to which they're named. So here's an outline showing you the areas that these spinal nerves innervate. Don't worry about memorizing this, but this is something that is a good reference. And then the last thing we're talking about are reflexes. There are inborn or intrinsic reflexes that are rapid, involuntary, and they give us a predictable motor response to a stimulus. So examples are ability to maintain posture and control our body organs. And then there's learned or acquired reflexes, which result from practice or repetition, like driving skills. When it comes to a reflex arc, it's going to have 5 different components. A receptor, which picks up on a stimulus, which gets sent to a sensory neuron, which has an afferent signal that goes to the central nervous system, where integration occurs, which decides on an output that travels via a motor neuron, via an efferent pathway to an effector, and that effector is going to be something that has an effect like contraction or gland secretion. So it may innervate something like cardiac or smooth or skeletal muscle, or different digestive glands or endocrine glands. And so here's a view of that reflex arc that both inborn and learned types of reflexes can utilize. Here the stimulus is a pin that is going to be picked up by a mechanoreceptor in the skin. That's going to travel via the blue sensory neuron to the spinal cord, where we have an integration center via the green interneuron, and then that's going to give information to the red motor neuron, which will be communicated to the effector, which in this case is skeletal muscle, which will most likely contract and kind of have you move your arm or your skin away from this painful stimulus. And there are reflexes, many of them at the spinal level, and their integration center is still the central nervous system. They might have effectors that are skeletal muscle, or they might be autonomic and have effectors that are smooth muscle or glands. But when it comes to reflexes, not all information has to travel all the way up to the brain. Instead, it just goes up to a certain level of the spinal cord, which is why we get a quick response. So with reflexes, oftentimes in a clinical setting, we can test these, especially somatic reflexes. They're the most important clinically to assess the condition of the nervous system. And that is it for chapter 13. That's kind of your overview for the peripheral nervous system. So we looked at the peripheral nervous system, what it includes and what it doesn't. And we've also looked at aspects of the peripheral nervous system as well as special sense organs, such as the ear, the eye, and the olfactory epithelium for smell. And don't forget taste, so gustation. Make sure to review all the PowerPoints, and make sure you've hit all the videos if you watch this one first.